So good afternoon. My name is Sadia Khan. I am the Director of Integrative Breast Oncology at Hoag Hospital. So my role at Hoag, I'm a breast surgeon, and I lead our survivorship program. Hopefully you guys have had a chance to stop at all the booths outside. We did have a booth for our program and some of the wonderful offerings that we have for breast cancer patients, breast cancer survivors, patients of all stages of breast cancer. And we're very excited to be here today to share on this panel. So thank you guys for having us. We have some wonderful speakers, including some of our physicians as well as our wellness providers that you guys can learn from and hopefully gain some interesting information today. You know, our program at Hoag, we are very dedicated to helping women who've gone through breast cancer. We take care of more breast cancer patients than UCLA and USC combined. As you all know, in Orange County, breast cancer is one of the highest incidents of breast cancers in this county. So we really pride ourselves in our wonderful program. We hope you find our information valuable, and we'd love to have you join us for any of our Hoag Healing events. We have quarterly events at the hospital that are free for anybody who's interested. Our next event is April 25th, so please look out for that information, and we'd love to have you and your family and friends join us. But you know, the idea behind our survivorship program is really focusing on all the risk factors in your everyday life that may have led to a cancer diagnosis and how you might modify some of those risks, and giving you tools and skills to help kind of move past your diagnosis, maybe some of the side effects from radiation, surgery, chemo, and really focused on helping you and your family members kind of go through the journey of cancer. So we're going to get started. Each of the speakers is going to introduce themselves and give you a brief talk on something that's relevant to their particular specialty, and then please jot down questions during the talks for if you want to ask a particular question to one of our speakers or just a general question, and I'll, towards the end, we'll open up for any questions that you may have. Okay, we'll get started.
So I'm Louis Vandermolen. I'm a medical oncologist. Been at Hoag for since 1993 and also part of USC CAC. So patients will often ask me what, from a general medical standpoint, from the standpoint of quality of living with breast cancer, and the best advice that I can give is really comes down to three things, and that is stay healthy physically. Get up, get out, get moving, walk, exercise 20 minutes, 3 times a week. So stay healthy physically, stay healthy nutritionally, eat, maintain your weight, try to avoid certain things that we'll, I'm sure, talk about later in this presentation. And then probably more important than both those things is to stay healthy mentally, positive expectation. Expect to do well, you will do well. It's a self-fulfilling prophecy. And in fact, inventories have been done where women who are taking chemotherapy are asked to fill out personality questionnaires, and women who would write, I'm concerned about recurrence, I think it's going to relapse, I think it's going to come back again, they had a tendency to recur, whereas women who said, I don't need this chemotherapy, I'm only doing it because it's an insurance, I'm going to be fine, I'm going to be cured, they tended to be cured. So positive expectation does have some impact on survival.
Great, thank you. We have a presentation from Dr. Nguyen. Get that started.
Well, good afternoon. I'm Dr. Vincent Nguyen. I am the medical director of the palliative care program at Hoag Hospital. And I've been there now for 7 years, and I oversee both the inpatient and the outpatient setting. And I'm also a faculty at UC Irvine teaching physicians and fellows the art of palliative and hospice medicine. What oftentimes I do see, though, is people have myths about palliative care, and I hope to address some of that with you today. And as you see palliative care, what's the difference between palliative care? How is that the same thing as end-of-life care? Is that hospice care? Is it all three of the above? I'll answer that at the end. But most oftentimes people think that when they come and visit, to come to see a palliative care physician, they think that the discussion will be oftentimes just all you're going to be talking about is advanced care planning. Let's talk about dying. But the reality is there's much more than that. we want to speak with you regarding what is your understanding of your condition. What are your fears? What are your worries? How are you coping? What are your support structure? And how are you doing with your pain and symptoms? Part of the work that we do is to collaborate with the treating team to help you live as well and as long as possible. We are the additional layer of support for you, for patients as they're going through living with serious illness. Oftentimes, advanced care planning is seen as, well, advanced care planning removes hope. But what it is, advanced care planning, when you really look at it, it removes distress. This is based upon several studies, one of which was done by Dr. Wright, published in the Journal of American Medical Association. When people have these talk about advanced care planning, let's talk about the future. Let's talk about what are some of the things that may happen. I wish it won't happen, but I need to have something in place just in case, an advanced directive of some sort. It actually decreased in people's depression and anxiety, because the reality is people are already thinking about it, but they don't bring it up. They're just waiting to have this discussed or someone to help them. And we often see that people have to live longer, better quality of life when they have these kind of talk and support. And with the visit to a palliative care physician, it's not just with me, but there's a whole team. I have a social worker, I have a chaplain to deal with the whole person care. And that's what palliative care is about, is to care for the whole person, what you're going through, and how this impacts and how the support that you will need or your caregivers will need as you go through this process. What we often see that at the end of life, there's a decrease in incidence of chest compressions and pulmonary resuscitations, which we know that don't work. And there is also a reduction in intensive care unit that is often not a best place for people in the last stage. But however, one of the things that we understand with the study is that there's caregiver burnouts and quality of life for the caregiver is much better with this extra layer of support. Other thing that people often think about is palliative care is associated with death. So let's not talk about palliative care because that's it talks about D words. But studies have shown that palliative care is associated with better quality of life and overall survival. And studies have shown this as well, Dr. Vandermolen, and most of the oncologists have seen this study in which early palliative care for patients, and this is not for breast cancer, but this study was published in 2010 by the New England Journal of Medicine, but it looked at early palliative care for patients living or suffering from metastatic non-small cell cancer. So what this looked at is basically comparing patients who receive standard oncology treatment versus patients who do receive the standard oncology treatment in addition to early palliative care. Early palliative care is when I'm diagnosed with a serious illness, I have a team of folks who will support me as I'm going through my treatment. What they found that these patients actually are happier, more functional, and they have less pain and symptoms. And at the bottom line is they actually live longer, about 3 months longer. We're having palliative care provided alongside with the oncological treatments. Oftentimes family will say, well, my oncologist can provide all the palliative care. Well, this is not to de-skill or undervalue the contributions of physicians providing primary care, but palliative medicine is a subspecialty in medicine in which we have physicians who spend an extra year after their residency to do this and practice it or to learn this art. And Hoag Hospital, in participation in conjunction with UC Irvine, I helped co-founded the Palliative Medicine Fellowship, and we have graduated 8 fellows so far, and we have 2 more coming up. And these doctors range everywhere from internal medicine, family medicine, to emergency physician, a cardiologist, an interventional radiologist, and a pulmonologist. So these are the kind of care in which doctors are spending the extra year to learn about palliative care. And so how oncology and palliative medicine can work with is that, this is really much a team-based approach. It's not based by one person, but a whole team. How do we care for a person? The other thing is the time factor. When you're focused in your doctors, your oncologists are treating your cancer, we want you to help you live well and live long. But there's also the psychosocial department in which sometimes it needs a 10, 15-minute visit. Oftentimes isn't enough. Most of the time, for the first time we see patients, we spend about an hour with them to really understand what goes on. And sometimes we spend as long as 2 hours for really to understand where patients are at. providing support to caregivers, and help with advanced care planning. So when you look at palliative care as this big, whole round circle, what I call as holistic, a whole person care, with a focus of relieving symptoms and stress of a serious illness, this is where end of life comes in. We recognize that with everything we do in medicine, we do not and we cannot give people immortality. At some point, the end of life discussion will be brought up, and people need to be cared for along the way. So end of life care is palliative care, but palliative care is not end of life care. So you see this as a continuum. It's only one small component of what palliative care is. And so where does hospice land? Hospice lands within end of life care, and which is hospice is palliative care, but palliative care is not hospice. And hospice focuses on caring for people with a prognosis of 6 months or less, and the curative treatments are exhausted, or patients are exhausted from the treatments. So at the end of the day, my message for you is, as physicians, we care about our patients. This is why we go into medicine, to help people live life as well and as fully as possible. And this is the gift of palliative and hospice care. Thank you.
All right, thank you so much for that talk. Our next speaker.
Thank you very much. Pleasure to be here with you all today. My name is Anusha Wijayakuma, and I am the wellness consultant and wellness coach at Hoag Hospital, where I lead on all of the mindfulness and meditation initiatives for their programs at the Women's Health Institute. So just a show of hands initially. How many people here are familiar with mindfulness, have a meditation practice?
Wow.
Wonderful. That's amazing. Fantastic. So for those of you that don't, and even for those of you that do, my goal for the time that I have here with you all today is to encourage and entice you all to commit to just 5 minutes a day. And I say that because nobody can tell me that they don't have 5 minutes, right? We might not have 60 minutes, but we've got 5 minutes, right? Because we spend 5 minutes doing nonsense, whether it's on, social media, whether it's watching videos, whether it's having, pointless conversations, which is fine, right? There's a time and place. I do it myself. We need to kind of have those breaks in our day to do the nonsense that we do. But at the same time, it's important that we make the time for self-care and self-love and self-acceptance. And that's kind of the focus of my talk today, because most of us in this room are women. And we, as women, know how hard we can be on ourselves. And I think some of the central components of meditation and mindfulness that people are not aware of are self-love, self-acceptance, and compassion for self. And just think about it. If we are actually able to embrace those three things, how much more fully and freely we can actually live, right? So think about that. So mindfulness, what is it? It's bringing our mind into the present moment. And if we think about it, most of us are not living our lives like that. Dr. Bueller and I were just having this conversation out in the hallway earlier. And when you start, mindfulness kind of gives you that license to turn the lens on yourself with love and compassion and to start looking at what's going on up here. And honestly, friends, it can become quite frightening when you start to really explore what is happening in your mind and those habitual thought patterns that we have, which are often negative. And Dr. Van der Meulen, I loved what you said about the mindset and the power of positive thinking. Where those that kind of were more fatalistic didn't have as good an outcome as those that had a more positive outlook. And that is why I am so passionate about working with the patients that I do at Hoag, because it's really instilling that power of positive thinking through the practice of mindfulness and meditation. Because through these practices, tomorrow, if you have been someone that has always kind of looked at life as the glass is half empty, you're not going to change your mind in 3 seconds. But with continued practice and dedicated effort, you will. And that's the power of these practices, right? It trains you to be more present. And why is that important? Because a lot of the time, we're not even enjoying our lives. You can be on the most idyllic beach, you can be in the best restaurant, you can be with your family, your friends, but if all that you're doing is thinking about the past, or worrying about the future, you're missing out on the beauty of the present moment, which is fundamentally all that we actually have. But most of us aren't living like that, right? We might even be doing it now. This is the litmus test. I'm sure you're all listening, right? Hopefully. But how many of us are thinking, what's happening this evening? What happened last Wednesday? What do I have to do tomorrow? What's happening next Saturday? And the list goes on. And we see, if we're honest, we all do it. And this isn't the time to start self-flagellating. Through mindfulness, it's much more about offering yourself that lens of love, compassion, and non-judgment. And to be like, you know what? We all do it. But how can I stop that? How can I embrace and liberate myself from the power of that habitual negative thinking, right? And we can do that through these practices. And it also enables us, now listen, of course we should learn from the past. Of course we have to plan for the future. We all plan to be here today. But it just means that we are able to actually start enjoying each moment of our life more fully. And really, a lot of the time we're not. Okay, so mindfulness, it's bringing your mind into the present moment, which is all that we have. It's beginning to realize that we can't change the past. Even what happened 5 minutes ago is unchangeable, and we can't predict the future. But I can tell you that if all you're doing is worrying about the past and worrying about the future, that is what is going to await you in the future. So all that we really have is control over this moment. And if we can start to live more fully and freely in this moment, we can start to liberate our minds from that prison that we live in, right? And now let me come to the whole self-love, self-acceptance, and self-compassion, because I think we as women in particular, we judge ourselves. This is how I put it. You've got the judge on one shoulder, you've got the critic on the other shoulder, and then you've got worry in the middle. And we just tend to be in that state. We're judging ourselves, we're criticizing ourselves, and we're worrying. But then also think about it. And there's an ancient saying, a Buddhist saying on mindfulness that says, we cannot give that which we do not have. So ultimately, if I'm not feeling love, compassion, and non-judgment towards myself in my own heart and my own mind, how can I really authentically give that to anybody else? I mean, I can't, right? And start to kind of think about, what you're thinking. Because if we're judging ourselves, really we're judging other people too. And we're criticizing other people, and we're doing that to ourselves. And ultimately, that's no way to live. So through the practices of mindfulness and meditation, we are enabled to stop doing that, right? To kind of train our mind to, as soon as we have a negative thought that pops in, for example, you're thinking about the past or you're worrying about the future, you stop that thought in its track. Think about like a stop sign. And you can either do one of two things. You can just cut that thought. You can literally visualize a pair of scissors cutting those negative thoughts, or you can redirect that negative thought to a more positive one. And this is what we talk about in yoga philosophy. Does anyone do, by the way, meditation is yoga, right? That is the whole purpose of why we even do the physical aspect of yoga, which is the asana. But does anyone do the asana here, the physical aspect of yoga? So if we look at the guidebook of yoga, which is the Yoga Sutras, an ancient guidebook, sacred text on yoga, so these aren't even my words. These were enlightened beings, basically, that were saying, if you have negative thoughts, it's simple. Stop them in their tracks. If you cannot redirect them to a more positive thought, literally visualize yourself cutting those negative thoughts. Because think about it, the more that you are able to do that and redirect the mind, the easier it becomes. Does that make sense? So just as an example, if I think last week I myself was having one of those moments. And think about it, the mind never just goes from 0 to 5. It goes from 0 to 500, right? So, we're often playing out worst case scenarios in our minds. And through a meditation and mindfulness practice, you were able to kind of, when you see the mind going in that direction, you're able to redirect it much more fully. So that's simple, right? The next time, trust me, we're going to have a negative thought, right? So I think we can be aware of that. Think about ways in which you can redirect that. Now, the other aspect of that self-love, self-acceptance is so important. Because if we are not, able to really look at ourselves with love and compassion, now, when will we? Right? So start to the next time you feel yourself or you hear that voice criticizing yourself, judging yourself, again, sit with that and try to offer yourself love, compassion, and non-judgment in that moment. Because the more that you're able to authentically do that from within, the better served you will be to bring that to other areas of your life. And I just want to do a little small exercise with you all before I pass on to the next speaker. So everybody here, just close your eyes for a minute. And I want you now to simply acknowledge, just take a second here to acknowledge what is happening in your mind. Without judgment, we're not trying to redirect anything here at this point. So whatever is present for you in your mind, simply take a moment to acknowledge it. Without criticism, without judgment. And now just bring some awareness to how that feels in your physical body and in your mind. So we're acknowledging, we're bringing awareness, and now I want you to take your focus to your breath and just really make that connection within to your breath. So everybody just take a deep inhale and an audible exhale. And let's do that 2 more times. Just a deep inhale and an audible exhale. 1 more time. And direct that to any areas of tension, pain in the body. And just release, and let's just sit with this practice for a moment of acknowledging, bringing awareness, and utilizing our breath, which is our anchor in life, and keeps us anchored through the changing tides of life. And now just open your eyes. So the breath, to end, the breath is what meditation and mindfulness is all about. And the good news is we all have it, right? Nobody needs to give it to you. You don't need to go and buy it. You've got it. And the wonderful thing about that is you can use it anywhere, at any time, driving, at the hospital, at the grocery store, at Starbucks, wherever you are, you can bring your attention to your breath, right? And take that inhale and take that exhale. And it says that we have the body and we have the mind. And it's our breath that interlinks the two together. So when we take an inhale and we take an exhale, we are enabled to come into the present moment. So thank you all. I will now pass on to Dr. Bueller.
I'm Dr. Stephanie Bueller. I'm a psychologist. My specialty is sexuality and relationships. I'm very happy to be here today to speak to you. And I'm here to talk to you about the emotional aspects of coping with metastatic breast cancer. And I know I'm speaking to a heterogeneous group, a mixed group. I see that we also have men in the audience, as well as women, but primarily women of many different ages and stages of life. Some of you are maybe on disabilities, some of you are still working. You may be married, in a relationship, single. You may have children or you may not. You may have children at home, or your children may be adults and you've raised your family. Wherever you are in your life, we all, cancer survivor or not, have one thing in common. We are all living with uncertainty. None of us knows what will happen in any given moment. And because of this central ambiguity, we could all be living in a state of constant fear, afraid to leave the house, afraid to be in the house, afraid even to be here in our own bodies. But we have been given a strange power, and that power is the ability to be in healthy denial. And what I mean by healthy denial is that we have the ability to push aside our fear of whatever lies ahead and act as if things are okay. And that is pretty much how most of us are able to live happily until something happens that makes us aware of our mortality. Something happens like cancer. Now, certainly cancer of any kind will bring us nose to nose with our mortality. I know because I've had skin cancer, as a matter of fact, on my nose. But, yes, indeed. I also know because my mother had ovarian cancer, and I was with her for every appointment, every surgery, every chemo, every recovery from chemo, and at the end of her life. And I remember after she received her diagnosis, while I was driving her home, she turned to me and she said, "Well, now what do I do?" And I said, "What do you mean?" And she tried again. She said, "I mean, what do I do now? How do I live?" And her question surprised me, and I had to think for a minute. How would she live with cancer, with uncertainty? But then it kind of dawned on me, like, well, duh, how does anyone live with uncertainty? So I said, as I've said now to many people with chronic illness or cancer who ask the same question in my office, I said, "Mom, either one of us could be smushed like a grape on this freeway any second. How do you live? You live. That's what you do. You live. You do what you love. You play with your granddaughter. You take walks. You paint. Every moment you feel well enough to be awake and present, be alive in the moment." And how do we live in the moment? And Anusha just did such a wonderful job of talking to us about that. Well, by being fully present, by showing up and experiencing all we can out of each experience we are given. And that means both the good moments, playing with children or painting, and the difficult moments, the MRI, the medicine. But because unless we have the difficult moments, we cannot appreciate the good ones. Difficult times, if you push away the difficult times and don't feel what you feel, then it's going to be harder to appreciate the good times. Instead, you'll be using your energy for unhealthy denial, trying to ignore the bad feelings that are going to be there anyway. You might as well feel them. Now, I'm going to give you a couple of useful tools for coping with difficult emotions, but now let me talk a little bit more about feelings when times are tough. Usually, when we struggle with our feelings, it means we are trying to escape from feeling emotional pain. The problem is there really is no escaping it. Anger, doubt, sadness, they just arise as they do. If you can just notice it and accept it instead of running from it, something interesting happens. It becomes just another experience in your life instead of something to avoid and run from. And sometimes, though not always, it becomes another important experience for you. Not necessarily a good experience, but informative. Your feelings, both good and bad, give you information. If you grieve, it gives you information that you love somebody. If you are sad, it means something was important to you. If you are angry, it means you need to define yourself and find your boundaries. Your feelings are an opportunity to communicate with others on a deeper level. Feelings create intimacy. All feelings, not just love. Experiencing all of your feelings, the fear, the sadness, the grief, also make you a more compassionate person. Just like experiences, the trip to Hawaii, the concert you saw, feelings create closeness. Never be afraid of your feelings. Notice them, accept them, wonder why they've shown up, and then let them go. Living well means coping with one's feelings. I'm going to give you some tools now for doing just that. And the first tool I'm going to recommend is to share your feelings with others. I know some people are better at listening to feelings than others are. In fact, sometimes the people we love can let us down when it comes to listening to our feelings. So instead of getting upset, just consider it a work in progress, and that might mean turning to a family member, a friend, or a support group where your feelings will be heard and understood. You need to find someone who isn't scared and who doesn't avoid feelings, someone who will listen without judging you and who won't interrupt. And that may mean finding a support group. Don't judge that. Go ahead and try it. It may be the best thing that you've done for yourself. The person who listens may also be a professional like myself, a psychotherapist who can not only listen to your feelings, but help you identify them, sort them out, and communicate them. Psychotherapist is a great resource if you have difficult feelings you don't understand or if you have conflicted feelings. A psychotherapist can also help you learn how to communicate your feelings constructively. Psychotherapist who specializes in cancer, and there are several in Orange County, will help you maintain perspective and manage fears that you may have. And seeking psychotherapy when you are troubled is the second tool that I highly encourage you to use. A third tool is to write in a journal. If possible, I recommend writing in longhand. Remember longhand? Instead of using the computer. There's research that shows that just the very act of writing is helpful. Someone recently told me that in Japan, school children learn to write in cursive as a meditation because it's relaxing and soothing. But whatever way you choose, keeping a journal can be a way to make note of your feelings and your experiences, and is a place where you can delve into what is important to you and a place to find direction. If you are worried about privacy, I will tell you that the classic place for women to hide their journal is at the bottom of the laundry hamper where nobody else will look. Or go ahead, put it on your computer. There are password protected applications for that. A related tool that I just read about and a piece of research about women with MBC is to write a letter of gratitude every week to someone you care about. And the study found that women who did this had fewer fears about their illness. The fourth tool is touch. As a sex therapist, I'm all about people touching each other in the most intimate way possible. But if sex has become difficult for you, there are ways to address this, books and information and so on. But if sex is off the table for any reason, touch is still important. Hold hands, not just with your partner if you have one, but with your kids and with your friends. Give and get hugs. Sit close when you're watching a movie. Get a massage, get a pedicure. The laying on of hands is healing in a way that words might not be. And if you need touch, ask for it. When someone offers you touch, take it. The fifth tool is love. Yes, love. We want to be loved, and we want to love. When we have love in our lives, it can make difficult times easier to bear. Jack Kornfield wrote, "Love creates a communion with life. Love expands us, connects us, sweetens us, ennobles us. Love springs up in tender concern. It blossoms into caring action. It makes beauty out of all we touch. In any moment, we can step beyond our small self and embrace each other as beloved parts of a whole." Every day you can ask, who can I give my love to? And every day you can ask, from whom can I get the love I need? Love can anchor us when other feelings make us uneasy. Feelings can be scary, yes, but it is possible to live with them. Feelings can be identified, noticed, and understood. They contain messages for us, and they can be shared. Difficult feelings can come with living with cancer. Difficult feelings come with living. The difference is that when you are living with cancer, you are more aware of how precious life is. And rather than being afraid, embrace life. Ask yourself, in the time I have left, how do I want to be with myself and with others? What is it I want to do? Then be that and do that. It's the work of life we all must do, whether or not we have cancer. It's the way we can live in a healthy state of denial and tolerate ambiguity. And this is what we call living. One more quote, please. Pema Chodron said, "When we're putting up barriers and the sense of me as separate from you gets stronger right there in the midst of difficulty and pain, the whole thing could turn around simply by not erecting barriers, simply by staying open to the difficulty, to the feelings that you're going through, simply by not talking to ourselves about what's happening. That is a revolutionary step. Becoming intimate with pain is the key to changing at the core of our being, staying open to everything we experience, letting the sharpness of difficult times pierce us to the heart, letting these times open us, humble us, make us wiser and more brave. Let difficulty transform you, and it will. In my experience, we just need help in learning how not to run away." Thank you.
Okay, we have a PowerPoint next. Just make sure you guys are jotting down any questions. When we're done with the talks, we'll open up for you guys to ask our wonderful speakers anything that you're wondering.
Dr. Bueller, I'd like to hold your hand. Thank you so much. My name is Leanne Martirosian. I'm a clinical dietitian at Hoag Hospital, and it's a pleasure for me to be here with you today. I'd like to talk a little about healthy eating for mind and body. I do have quite a bit of information today. I'm going to be moving through pretty quickly. So I do have a handout with a summary of my slides, as well as in my email if you'd like to have a copy of my slides after the presentation today. So as a dietitian, I get asked all the time, Leanne, I'm going through cancer treatment. What should I eat? What should I not eat? Well, there is no single food or nutrient that can prevent cancer or its recurrence, although there are many nutrients that demonstrate anti-cancer properties. It is truly the synergistic effect of the whole foods that we eat that offers us the most protection. I think one of the real deep problems is this chronic inflammation that we're running around with. This can damage our cells, weaken our immune function, and increase our risk of cancer as well as other diseases such as diabetes, heart disease, and Alzheimer's. A major source of inflammation trigger foods in our society comes from processed foods. These are low in nutritional value, high in sugar, high in fat, and loaded with artificial ingredients that can increase C-reactive protein levels. This is a blood protein that can trigger inflammation. So how do we eat to stop inflammation? I want you to eat a rainbow of fruits and vegetables. I want you to flood your body with phytochemicals, these substances that help stimulate the immune system, protect our cells from carcinogens, and reduce inflammation. Phytochemicals can help slow the rate at which cancer grows. I want you to eat your healthy omega-3 fatty acids, fish, nuts, seeds, avocado, olive oil, while decreasing your intake of the omega-6 fatty acids, which are typically found in processed foods. I want you to eat your vegetables, lots and lots of vegetables. I don't care if they're fresh or frozen, cooked or raw, smoothies, salads, soups. I want you to eat fruit, again, whole fruit, not dried fruit or juices. I want you to eat your high fiber complex carbohydrates, whole grains. I want you to eat your beans, your split peas, your lentils. I want you to eat fresh herbs. Put basil in your salad. Put cinnamon in your oatmeal. Add turmeric to your chicken and vegetables. And then, of course, the healthy fats, including nuts, every day. Oops, excuse me. I want you to choose poultry, eggs, fish, and dairy in moderation, and treat red meat, processed meat, and the sweets more as a special occasion food. This eating pattern is high in fiber, those healthy omega-3 fatty acids, as well as those immune-building carotenoids. The carotenoids in dark green leafy vegetables can inhibit growth of breast cancer cells. Finding a healthy weight is an important part of survivorship. Excess body fat is strongly linked to increased risk of recurrence and metastases. The Wells study showed that most women undergoing chemotherapy had unwanted weight gain and suggested that weight loss is required to show improvement in breast cancer outcomes. Fat cells produce estrogen as well as proteins that cause high insulin levels, which we know can promote cancer cell growth. Inflammatory cytokines can lead to chronic inflammation, which we know is also linked to increased cancer risk. To find a healthy weight, I want you to start by setting small, realistic goals that are achievable. Start with a small goal, 5 to 10% of your current body weight. Don't put undue pressure on yourself, and certainly don't indulge in guilt. Make sure to include your family and friends in your weight loss goals. Exercise can combat that hypo or slow down of our metabolism that typically occurs with breast cancer, and it can also strengthen our immune system. I want you to include activity that raises your heart rate as well as helps preserve and build lean body mass. Exercise, I think, is also a very effective tool at decreasing the stress hormones in our body and helping to manage the symptoms of depression. Start wherever you are and increase the time and intensity of your exercise within your body's abilities and limitations. Portion control is really the key to reducing calorie intake. Stop drinking beverages with calories. Stop drinking beverages with calories. Now I'm getting out. Oops, sorry, there we go. Stop drinking beverages with calories and limit the added fats and snack foods. Eat mostly plant-based. I want you to have a goal of eating 2 cups of fruits and 3 cups of vegetables every day. However, if you're going through treatment and unable to eat well, then all bets are off. Eat and drink whatever you can to get through. Short-term intake does not have long-term consequences. The one thing in common among people who have successfully lost weight is accountability. One tool that I suggest is the application MyFitnessPal, very easy to download on your smartphone. It's a great tool that can help you increase awareness of how much you're eating and why you are eating. I suggest using the plate method as a guide, very simple. Half your plate should include fruits and vegetables, a quarter of your plate should include high fiber complex carbohydrates, and a quarter of your plate lean proteins. While this is an excellent visual representation of how I recommend you eat, the 9-inch plate is likely too large for most breast cancer patients. You may need to choose a 7-inch or even a 5-inch plate. When eating out, my teenage son and I have reversed roles. He orders the adult size entree and I order the kids' meal. Eating plant-based can be daunting, but it's colorful, tasty, and I think it's absolutely delicious. We eat for a lot of reasons other than being hungry, so pay attention to why you're eating and how you're doing it. Slow down and enjoy your food, knowing that the choices you make will help you move towards your individual health goals. To get back in touch with your natural appetite, remember to stop eating when you're no longer hungry, which occurs far sooner than when you feel full. Eating according to a bunch of rules is not fun or healthy and tends to only give us the illusion of control. A lot of money is spent on complicated, overly strict fad diets that tend to induce a lot of stress and guilt when we're unable to follow them. Our immune system is based in our gut and is often disrupted due to cancer treatments and antibiotic use. I do recommend taking a refrigerated probiotic with at least 10 billion organisms per dose. However, if you are neutropenic or immunocompromised due to chemotherapy, I do not recommend taking a probiotic supplement. However, you can eat fermented yogurt and a variety of fermented foods instead. Okay, so a few myths and facts to talk about. Eating moderate amounts of soy is considered safe for women with breast cancer and does not increase a survivor's risk of recurrence. Some small studies show that it may be protective for women taking tamoxifen, but more research is still needed. Choose whole soy, such as soy milk, soybeans, and tofu, rather than concentrated powders or supplements. Well, the keto craze is once again upon us. It is now showing some promise in the treatment of primary brain tumors, but there is no evidence of benefit in breast cancer. And I would consider it dangerous given the extremely high fat content. While there is no strong evidence to show a lowered cancer risk by eating organic foods, I do believe that reducing our exposure to harmful chemicals and pollutants is a healthy choice, especially when it comes to preserving liver function. So what do? I aim for the 90-10 rule. 90% of the time, I try to eat 5 things: vegetables, fruits, high fiber complex carbohydrates, lean proteins, and healthy fats. That gives me 10% wiggle room for fun food. I'm gonna eat a piece of chocolate cake with cream cheese frosting on my birthday, and tonight I'm probably gonna have a slice of pizza and a glass of beer to celebrate. You may have guessed I like dessert. So for some people, it may be more of an 80-20 rule or a 70-30 rule. The point is, build that solid foundation of healthy nutrition so when you do have celebration food or traditional food or fun food, there's absolutely nothing to feel guilty about. Really take small steps that you can create habits for a lifetime so that you can feel well and be well. Thank you all very much.
Okay. Any burning questions off the bat?
Well, the Women's Initiative does give us some guidance, and some of those things were touched on today. And weight reduction or maintain a normal body weight, exercise, eating healthy, all of these things have been shown to lower the incidence of reoccurrence. So just echoing what's been said, has all been shown scientifically to be true.
Thank you for that question, because that's been one of the things in which folks in palliative care, we're out there beating the bushes and say, look, we're on your team. We're not the scary people. We're here to help you live well and live long. But we also understand, too, is that there are fears when palliative care is discussed, like the first slide I share with you, because people often think palliative care means giving up on life, means giving up on treatments. But again, how do you embrace this and get this education out there? Well, it's through people like you. It's a word, I guess it's not necessarily a vertical integration where I'm telling you this is what you're gonna do, but it's based upon your own experience. And I recognize there are a few people in this room who are my patients in palliative medicine, and they're living and they're doing quite well. So we're pleased. So thank you. And the other piece I really think is important is to work with our oncologists and ask your oncologist. In one of my slides, I said, look, ask your oncologist to say, hey, what do you think about getting palliative care involved? And of course, there's not a whole lot of palliative care doctors out there, and that's why we're part of the training process to get people involved. So thank you again for that great question.
That is a big question, and I get that a lot. I think really monitoring yourself and keeping a log not only of what you're doing and how you're feeling, but what you're eating and how much you're moving. The hypometabolism that occurs with breast cancer and associated treatments can be really dramatic. And it's hard for me to sit down with a patient and say, you know what, you only get 1,200 calories a day. That's really little. And we tend to eat far more than we actually think we do. So having some kind of tracking tool to really get down to the nitty-gritty and find, well, yeah, those 10 jelly beans really do make a difference. Or, you know, that glass of orange juice that I thought was so healthy for me, I just took in 120 calories. That's 10% of my intake for the day. So it really takes, unfortunately, being very strict, very diligent on a daily basis. I can't reinforce the benefit of moving your body in a healthy way every day enough, whether it's 10 minutes 3 times a day, adding in some strength training to help build lean body mass, get that muscle mass on you that can help increase your metabolic rate. It all adds up, but it's going to take really diligent work in a lot of small ways every single day.
So while on chemotherapy, we tend to advise against it for the concerned neutropenia, low white count, increased risk for infections. So we prefer that you eat foods that are cooked or prepared. After that, it's not a concern. So it's just during that period of time that you're actively on therapy.
I think preserving your lean body mass is the first step. It's going to be almost impossible to build lean body mass during treatment. So making sure that every day you're doing some kind of strength training, whether it's simply sitting in a chair with your soup cans or your 3-pound dumbbells, and keeping those muscles moving so that we don't lose them during treatment. Walking and cardiovascular exercise, of course, is wonderful, but that burns calories, so we need to focus on that strength training. You know, if you've had surgery or you have lymphedema, then you certainly have some limitations. I would encourage you to go see a physical therapist to get professional guidance, but absolutely getting in. I have a terrible metabolic rate. I don't have breast cancer, but I have a metabolism like a slug, so every day I'm doing some kind of squats or lunges. I'm waiting for the water to boil and I'm doing my little squats, or get down and do some push-ups. I think that's really the main strategy to keeping that lean body mass from being depleted during treatment. think the gold standard is always walking. Invest in a really solid pair of shoes that provide you stability and cushion so you're not stressing out your skeleton, and don't walk on concrete. I like to walk on dirt or a track that's made out of some kind of plastic so you have that cushioning, and just start really slow. Don't go alone, get a friend, so in case you're having discomfort or pain, you can stop. But start with that just little 10 minutes. I think swimming is wonderful because you will support your skeleton. And then working up to something like yoga, so you're using your
Gentle
muscles,
yoga.
but in a very slow, safe, steady way.
Thank you. That's a great question, Dr. Khan. Thanks for that. And just my simple answer is, like I spoke about, 5 minutes, right? And a good time to begin that practice is as soon as you wake up. Because if you wait in your day, the day gets ahead of you. So think, your alarm goes off in the morning, maybe even set 2 alarms, 5 minutes, and you can simply just focus on your breath, whether you're counting for 3 on the inhale, counting for 3 on the exhale. There's countless meditation apps out there, Headspace, Calm, there's free videos on YouTube. There's so many resources that are available for free. But I would just simply say, whatever you're doing, do it, and set aside a dedicated time. Because if you don't, you won't do it. So I always suggest the morning, and preferably within the first 30 minutes, right? And ideally not after any kind of caffeine, because that's kind of the polar opposite of what you're wanting with the meditation practice. So if you're somebody that's dying for the caffeine as soon as you wake up, brew the coffee, do your 5 minutes, it'll be ready for you. And be consistent. So if you're going to do it in the morning, make sure that you do it. That's why I always say as soon as you've risen is really good. And you can do it lying down. Because for a lot of us sitting, people think meditation, we have to be sitting in Padmasana lotus pose. We've got to be staring at the tip of our nose with the tongue on the roof of our mouth. That's completely incorrect and inaccessible for most of us. Meditation can be done lying down. The key with any type of a meditation practice is simply that the spine has to be straight. So you can do it lying down, but legs are uncrossed, arms are just down by your sides. You're lying flat on your bed, so ideally not even with a pillow, maybe just on the mattress or on the floor with a blanket. You can be sitting in a chair. That's a great place to do it as well. So just think, it doesn't really matter where it is, the spine is straight and you're doing it.
I think we are wrapping up. This is the end of our panel. We really hope you guys enjoyed all the tidbits of information. I always find that I learn something every time we have an event like this. Please join us for any of our Hoag Healing events. Many of our providers come and give quick talks, and we do kind of this format where it's a panel and question and answer, and all of you are more than welcome to come. I'm just going to end with one quick piece of advice. So Hoag recently participated in a national study on breast cancer patients that looked at the genetic testing guidelines. So there's very strict criteria for who can and cannot get tested for genetic mutations that might lead to breast cancer. If you were tested over 5 years ago, please go back and get retested. You qualify for update testing. That can be important to you or your family members. And the second thing is a new study that we participated in. We enrolled women who met the general criteria or the very particular criteria, but we also enrolled just as many women in this study who had breast cancer that didn't meet that particular criteria. And in this study that was done nationally that we participated in, half of the women who didn't meet the original criteria that we tested were found to have mutations. So the American Society of Breast Surgeons put out a consensus guideline that recommends any person with breast cancer to go and be tested. So please talk to your physicians, seek a genetic counselor. We have a wonderful program at Hoag, and once this consensus guideline was put out, insurance companies and genetic testing companies are trying to put up money to help women who don't traditionally meet the guideline get tested for free. So please make sure that you're talking to your doctors, and it's great information to have for you and your family. Thank you so much, and please, round of applause for all of our speakers.
Thank you very much. I really appreciate it. We are going to be waiting for the next group to come in, but before we talk about that and wait, have them come in, one of the things that you probably want to know is that if you do get progression, it's also a good idea to get retested as well. And I know it was covered a little bit earlier, but I would ask your doctor that you have a new metastatic lesion. Your lesion's getting bigger as opposed to smaller. See if they can do some kind of a biopsy. Sometimes they can't, sometimes it's not available. And see if they can do a molecular test on it so that they can find out what the existing profile is of that tumor, and that can guide a better outcome in the type of treatment that you would be getting next. So anyway, thank you so much, and we will be back in a couple minutes.